First thing we're going to do is use some chlorhexidine to wipe the area, to wipe away anything that can cause contamination on both sides. Thorough cleaning. You can see that we have a nice lateral zygoma, but the mid-face, significant depression right in this triangle. Our objective is to make this so that it doesn't fall in this groove as it comes out a little bit and descends gradually. Instead of falling, we're going to make sure that kind of it descends gradually. We're going to use hyaluronic acid. Start at malar eminence. That would be our start point. I'm sorry. Tell me in case you need any break, okay? Small injection. Less than 0.1 per injection without too much pressure. So slowly we can see we're starting to make that transition a little bit smoother across. The injections are performed in the deep subcutaneous tissue. The location of the infraorbital foramen is in this position right here. And the amount of injections are less than 0.1. In my case, it is 0.05 per injection, slow injection, low pressure, slight retrograde when I'm injecting. This is infraorbital hollow. For this area, I'm going gently to the bone, small amount, exit, and massage medially towards the foramen. Once again, slow pressure. If I feel resistant, I reposition because blood vessels do have a level of resistance. Especially arterial walls are a bit thicker, therefore you should be able to a certain extent, feel some resistance encountering that. I'm right on the periosteum. Sometimes this is uncomfortable for the patients. You may feel a sensation towards the upper lip because the infraorbital foramen is very close by. We can see how this area is becoming more even. So I want to make sure I focus in this area. Of hyaluronic acid. In this case, it was contour. So looking at this side, we have a drop here. Here we can see the drop is far less. There's still a little bit of a transition that I need to do right about inferiorly underneath the maxillary bone towards the buccal hollow. Our goal is to make the transition smoother. We're not trying to make the face look puffy or swollen. Many a times, we can do this in 2 sessions. If somebody needs a lot of filler, it's best to bring it back in a few weeks and inject some more again. So what's important to see how this transitions from one side, one dimension to the other. So once again, we're just going to take a look here. You can see the significant amount of depression here. We have the nice malar eminence. We're going to use malar eminence as our guide. Entering slowly, feeling for any resistance at the tip of the needle. Mild retrograde. Small amount, less than 0.1. Once again, this is a sensitive area. So I'm using the malar eminence in this case as my focal point. When you see any kind of a bleeding, just keep pressure to decrease the amount of bruising. So objective is, again, what I think about is malar eminence. I want to make sure from here to here I can connect the 2 points in a smooth transition, but not a dip. We had approximated that we would be using about 1.5 cc per side, and in practice it seems like that's exactly what's happening. That 3 cc's are what we need. Slow injections because there are a lot of vascular tissue in this area. What's important, if I feel any bounce back or slight pressure at the tip of my needle, I will reposition down to the periosteum in this area, just lateral to the infraorbital foramen, 0.05, exit, massage towards the foramen. The periforamen region is one of the most common areas that gets hollow. Once again, anything like that is common. Just keep pressure on the area. That's it, to decrease the chance of bruising. Once again, I'm right in the subcutaneous region. I'm close to the infraorbital neurovascular bundle. Patient needs to be cautioned that they can have some numbness of the upper lip. That's normal, and the lower eyelid, and only lasts about 15 minutes or so. Now, this product I'm using mostly for mid-face, but I want to make sure I transition into the infraorbital foramen. In the future, we will use a different kind of hyaluronic acid for infraorbital hollow, which is a little softer than contour. Although you can use contour, but the product is designed for deeper tissue and for creating more bulk than what we need for the intraorbital foramen. But it's important that what we use for the infraorbital foramen is not hydrophilic, does not absorb a lot of water. All I'm doing is subcutaneous tissue just to make sure that transition is smooth all the way across. That's all. A bit more medial, immediate is subdermal region. 1 or 2 injections and then we're done. One more in the infraorbital hollow, just a slight amount. Right on the periosteum. And then massage that superiorly. Another session in the future, we will work on the infraorbital hollow using a little bit of chlorhexidine just to clean the area. And then we're going to keep a little pressure to decrease the chance of bruising in this area. Maybe you put pressure. And then at the end, I like to go ahead and make sure it's massaged smoothly, and we use some arnica gel for that.